So for that, normally we have some exercises that we can show the patients. So what do you think about that, Brian? So do you have some exercises that you can teach the patients when they come to you and they're complaining about that?
Yeah, there's definitely a lot of exercises you can do. One of the biggest things is the cervical spine is really, you want it to be as stable as possible. So when you do exercises, you can exercise in that direction. So don't really you don't need to attach a weight to your head and try and lift weights like this or anything like that. That's counterintuitive. No. But a real simple one is placing your hand on the side of your head, making sure your neck is straight, and then just applying light pressure with your hand and then resisting. And then doing the same thing on the other side. You're standing up as straight as you possibly can. You go, you apply light pressure, and then you resist that same pressure. You resist that hand, and that's going to work out some of those lateral portions of the neck. You can do the same thing going forward, and technically you can do the same thing going backwards, right? So you don't ever want to be in a position where you're compromised, though. You don't want to be here first, and then put a hand, apply pressure, and then try and resist it from already a compromised position. So always make sure that you're in a neutral position and start off very easily and gradually.
So let me ask you, how often you ask that to the patients? Like how often, how many times a day, or how many times per week? Because those are the things that normally a lot of patients, they want to ask us when we're in the clinic. How many times I should do the exercise program? Should I do it once a week? Can I do it once a month? Can I do it 4 times a week? So what do you recommend there on the patients?
I definitely recommend that they do this. If they're experiencing a lot of neck pain, obviously consult your physician prior to engaging in any form of exercise. But you can definitely break this in 2 times in a week, then 3 times in a week. And this is such a low, easy impact exercise that if you do 2 to 3 sets of it, it's something you could probably do every day. Because it's not anything that's high intensity. It's not something that's going to continuously tear the fibers of the muscle. It's a low impact, easy exercise you can apply and just do throughout the day, and you can probably do it every day.